All right, everyone, good afternoon. I have the honor of introducing our keynote speaker, Ariana Golchin, PAC. Ariana is a board certified PA working full time within PA education as an assistant clinical professor at Idaho State University. She dedicates much of her time outside of work educating the community on prevalence and importance of mental health due to her commitment to implement long-lasting change. She has passion for leading projects that promote mental health advocacy and destigmatization. She currently sits on the board of directors for the Association of PAs in Psychiatry, the APAP, in addition to serving as an ambassador for the NCCPA. Please welcome my friend and our keynote speaker, Ariana Golchin, PAC.
Thank you, Liz. Hi, everyone. I'm so excited to be here today. This is like one of my favorite things to do. I love being a PA, but honestly, it's about connecting with students. That is truly my favorite part of being a PA. I've had a few different roles so far in my career, and this is by far the best part. So I just want to thank all of the directors, everyone who has put in so much work to putting this conference together today and inviting me to speak to you guys. My biggest hopes for today are that you guys, you've been here all day hearing about burnout. There have been some phenomenal speakers. So I'm sure there will be a little bit of overlap. So I might zoom through a couple of things that I know were kind of touched on, just so we can kind of focus on some other things. But I really just want to validate your concerns, talk about burnout, try to relate with you guys, and just really emphasize burnout, mental health. We're here to normalize mental health because this is something that is not talked about, especially in medicine and especially in PA programs. So that's why we're here today. So we will get started. And let me know if there are any issues with my slides because I haven't been on Zoom for a long time. Okay, so I'm just going to skip this slide because Liz did an excellent introduction. So that's me. These are our objectives. So I will not bore you with reading through them. Basically, we're going to talk a whole lot about mental health and burnout. We're going to give you some coping strategies and some tools that you can put in your toolbox to help you get through those challenging times. And we're going to give some mental health resources as well. Okay. So first things first, you guys, who does mental health affect? I think that we all have this stereotype built up in our heads of whom we think mental health affects, or, what someone may look like that mental health is, affecting, those who suffer from a mental health condition. But the truth is that, this is not a one size fits all, plain and simple, everyone. Every single individual is going to experience a mental health condition at some point in their lifetime. And bottom line, like I'm saying, mental health does not discriminate based on gender, race, ethnicity, age, sex, color of skin, sexual orientation, identity, income, social status, ability, etc. And something that I like to remind everyone, it's not a matter of if, but rather when. So let's discuss the stigma that surrounds mental health today and how that severely impacts an individual's decision to, one, be open and vulnerable with how they're feeling, and two, seek out help and treatment. So I feel like society has continually put us down for being open with mental health related concerns, anxiety, depression, substance use disorders. We are often ostracized and perceived as being weak, attention seeking, drug shopping. I'm sure those of you who are in your clinical rotations have already heard those things being thrown out by those who are working in medicine. Just like pretty common, if we're being honest. Prejudice and discrimination are large reasons for the disconnect between seeking care and effective treatments. So let's dive into different types of stigma and then also discuss common factors that impact our decisions to seek out mental health treatment. So we have self-stigma. This occurs when a person internalizes negative labels, which can lead to low self-worth, shame, and hopelessness. It is associated with delayed treatment, worsening symptoms, poor recovery, and high rates of suicide in some cases. And then we have social stigma. This is going to refer to the stereotypes that the public assigns to individuals and is often associated with discrimination. So this can exist within families, religious communities, work environments, social groups, professional organizations. Both social stigma and self-stigma can serve as critical barriers to treatment and recovery. So here on the left, you will see some other factors that can influence our ability to desire and seek out mental health care. So lack of education, negative attitudes, stereotypes, discrimination, culture, and workplace. So what role do we each have in reducing that stigma? So raising awareness through self-reflection is going to be an important first step. Doing our part to understand our unconscious biases, and by recognizing our personal biases, one will more likely be able to, be empowered to inform and educate others. Being conscious of our words and what we're saying, our language is going to be really important. So again, oftentimes we're throwing out the words crazy, OCD, bipolar. These are also terms that come out pretty frequently. We just need to kind of be mindful of what's coming out of our mouth and emphasizing wellness. We can also respond to misperceptions or negative comments by sharing facts, experiences, educating ourselves and others on mental health and what that can look like. And then speaking up and normalizing mental health. In healthcare, we are often looked upon as being invincible and needing to be constantly striving for more. I'm sure you guys feel like that as PA students. It's just more, more, more. You're not doing enough, more, more, more. We base our self-worth on productivity levels, and unfortunately, that doesn't really stop after we're PA students. It kind of follows us as we are practicing clinicians. We're not machines. We're not supposed to be machines, and we should not be held to this standard of perfectionism that the world holds us to. Our employers and perhaps our PA programs think we should, but we need to remember that we do not need to be perfect robots, and we shouldn't be. It's not healthy. So it's also really important to talk openly about our mental health, share our experiences, and remember that it is okay to be vulnerable. For those of you that know me and know me through my platform, it's kind of a ridiculous name, but it's Sparkles and Scalpels. You guys know that when I was a PA student, I am super vulnerable on that account. It's just a place where I serve realness, rawness, and I'm vulnerable. It happened when I was a PA student, and I still do as an educator. Some people probably look down upon me for doing so, but it's how I connect with those around me. It's how people feel safe. And I encourage you to be brave and be vulnerable, because it means that you are a human being. And we also connect to our patients that way as well. So support your classmates. They are going to be your colleagues one day. Let them know that they are not alone and that you support them. Peer support can also act as counterbalance to the discrimination, rejection, and isolation people may encounter when trying to seek mental or substance use treatment and services. So when I think about how many of us PA students are out there suffering silently, it's really sad. It's pretty eye-opening, because there is so much judgment placed upon us for wanting to take care of ourselves and wanting to take care of our mental health. And that judgment really needs to stop. We need organizations and PA programs that are supporting and promoting a culture of taking care of our mental health. But the big question, and something you've probably been hearing all day, how do we promote that change? Where do we start? And the truth is, we all can be part of that movement. We all can be part of that change. So we keep making noise about this topic. We keep having conversations. We keep using our abilities to advocate, to educate, to normalize mental health. We have come a long way, but there is a long way to go. So conferences like these, where people can come, they can come as who they are. They can share their stories. These are super important. So I want to thank you guys for putting on this conference and allowing people to share their experiences. And I am messing up Zoom again, so bear with me. Okay. So my biggest takeaways, mental health is health. We should be treating mental health the same as any other condition. Mental illness is a medical condition and deserves the same respect, patience, and attention. One of the most important things I like to remind my patients, myself, my family members, really anyone, is that no matter what an individual is dealing with, they are not their diagnosis. They are simply an individual who is battling anxiety, depression, substance use, whatever it may be, because that's where we get into trouble, because labels and stigmas hurt. So now we're going to kind of build upon everything we've discussed so far and tie it into PA student and provider burnout. So you guys had a specific lecture this morning on burnout, so you may be familiar with this individual. So I figured this would come up again. I just wanted to do a little brief history, so bear with me because you probably already heard about this. But this is this is Herbert Freudenberger. So he was a psychologist working at a free substance use disorder clinic in New York City. He was putting in extreme hours when he decided to look into the mental well-being of the caregivers at the clinic. So something that I really wanted to share from this slide with you guys, and why I did not take this slide out, was this quote. I feel like it's very powerful, and so I'll read it out loud for you guys. So as a practicing psychoanalyst, I have come to realize that people, as well as buildings, sometimes burn out. Under the strain of living in our complex world, their inner resources are consumed as if by fire, leaving a great emptiness inside. Although their outer shells may be more or less unchanged, only if you venture inside will you be struck by the full force of the desolation. For me, that was very powerful because it truly does encompass burnout and kind of emotions that we all may have experienced throughout our PA journey. And then you have Dr. Christina Maslach, which you may be familiar with. So she had just received her PhD studying how people respond to crises and was starting her research career at Berkeley. So something notable for Dr. Maslach is she was the one who created the MBI, the Maslach Burnout Inventory. So it is important to understand that burnout has been prevalent for quite some time. However, it's been really the last several years as healthcare providers that we've really noticed burnout really coming into play, because it's really been exponentially intensified, especially with that global pandemic. So how do we define burnout? Burnout is characterized by emotional exhaustion, depersonalization, and a decreased sense of personal accomplishment. So I went ahead and I have some articles that are cited throughout this presentation, and I just pulled some definitions of burnout, and I put them on this slide for you guys. So if you were to read through them, they all pretty much basically state the same thing, and we can gather a few things and notice a common theme here. Burnout is basically the negative impact of physical and mental well-being secondary to work, and in your situation or your case, education, schoolwork, and course load. So who is at greatest risk for experiencing burnout? So burnout seems to occur mainly in professions involving an interaction with people. So oftentimes healthcare professionals and educators. It's also important to remember that professional health students, such as all of you sitting here with me today, fall into this very high risk category. However, the syndrome has also been described in other professions. So I think it's really important to remember that students who are enrolled in these programs are going to be at risk, because everyone is focusing on burnout in those who are actually out into the field, and they oftentimes are forgetting about all of you guys. So we're going to expand on that. Okay. So before we dive into some data regarding burnout, I just want to preface that despite the wide variety of healthcare professionals and pre-professional students that do experience burnout, depression and anxiety, research has mostly focused on physicians and medical students. But on the flip side, that really does give us room and opportunity to get in there and do research ourselves. So just in case you're interested in doing research in the future as PAs, there is a lot of opportunity for that. So with that being said, there is even more limited research in regards to PA students. So it's important to remember that burnout does and can occur while you guys are in school. So you hear the term burnout widely among healthcare professionals, and like I said before, I think we fail to recognize that you guys are all at risk. So something that I've been pondering lately, we see there are increasing levels of practicing professionals who are experiencing burnout. However, was that symptomology of burnout never acknowledged or addressed as students, and the cycle has just been continuing on and on? I don't know. Something that would be interesting to kind of get to the bottom of. So I think it's very critical to have that early intervention and not have solutions just be limited to PA practice. So we'll expand on that some more. Interesting thought. So to further expand on that, I do have some PA specific data to share with you guys. So according to a study conducted by my fellow colleague, Dr. Talia Sierra, and they basically have the burn clinic. If you guys are interested, they founded the burn clinic, which is designated for providers who suffer with burnout. Her name is Heidi Posey. She's also a PA. So they founded this organization together, but they conducted a study, and there were a total of 1,050 PAs and students who responded to this study. And this study showed that 14% of practicing PAs were found to be at moderate to severe risk for depression, in comparison to 25% for PA students. 12% of practicing PAs reported moderate to severe anxiety symptoms, with an additional 21% reporting mild symptoms. Among PA students, 21% reported moderate to severe symptoms, an additional 21% mild symptoms. 8.2% of practicing PAs and 8.1% of PA students had said they felt suicidal since starting their career. When asked if they had attempted suicide, only 0.4% of practicing PAs said they had, in comparison to 3.2% of PA students. So as you can see from this study alone, PA students are very much being impacted and affected emotionally and psychologically. To give you a broader perspective on burnout within the PA profession, this data comes from the 2021 statistical profile of certified PAs that was published by the NCCPA. So as of 2021, there were a total of 158,470 PAs practicing, and around 133,000 PAs provided feedback and responded to this survey. So the data unfortunately showed that PAs, like other healthcare professionals, are experiencing higher levels of burnout. Not surprising though, with everything that we've been going through. In 2020, 73.4% of certified PAs denied having any symptoms of burnout, compared to 69.4% in 2021. And in 2020, 34.2% of PAs were considering leaving their principal clinical position due to burnout, compared to 40.2% in 2021. So kind of going off of what I stated earlier, there is a lot of data out there, but most of it remains specific to physicians. So that being said, we're going to dive into some more data. This is related to physicians in particular. So according to the 2022 Medscape National Physician Burnout and Depression Report, burnout has increased from last year's report of 42% to 47%. 46% was reported in 2015 and 39.8% in 2013. So as you can see, this trend has continued to climb and climb and climb. So burnout increased for both genders in 2021. 36% of men and 51% of women reported burnout in comparison to 2022. Reports claimed an increase to 41% for men and 56% for women. So some of you may be wondering, why is this rate higher in women? So the answer to that was because supposedly there were more responsibilities and roles among women, in addition to more women self-reporting based on the article. So ideally, what predisposes one to experiencing burnout? Well, there are some personal factors and characteristics that may contribute to burnout, including compulsiveness, guilt, self-denial, strong need for recognition, high self-expectations, being self-critical, demanding perfectionism, turning to unhelpful or unhealthy coping strategies, sleep deprivation, overcommitment, inadequate support systems outside the work environment. You know, many of you students end up packing up your entire life and leaving to go out on this PA journey. That's really challenging. I often tell this to the students that I teach. Many of us in medicine have a type A personality. Would you guys agree with that? But when we get in PA school, we become triple A's. I think that we are triple A, which makes it more challenging because the stress has been taken, it's here, and it's been taken up to here. And it's not really our fault because we are just consumed and we're consumed. And how many of us put in our personal statements that we are flexible and we are adaptable as PAs? Am I right? Well, we are flexible and we are adaptable to a fault sometimes. That is just the problem. It's because we have this expectation set out for us that we have to keep meeting and meeting and meeting in order to survive. And it's not healthy, but that's how it has been. But the last bullet that I really want to focus on, while there are all these characteristics that make us prone to experiencing burnout, how about working toward or in a medical culture that emphasizes and demands perfectionism, denial of personal vulnerability, and delayed gratification? And then we have some more. So these two slides have very, very long lists, and I kind of did that on purpose, especially for this one. Excessive workloads with time pressure, long work hours of the day or long class hours, very, very long. You guys are there from 8 a.m. until 5 p.m. scheduled, and then you're studying until who knows when, sometimes the next day without sleeping, unfortunately. It's very, very long hours. There's poor institutional organization. Sometimes there's a lot of lack of communication. It just depends on where you're at. Increasing responsibility, decreased control over working demands and environment, lack of time due to additional requirements and responsibilities, additional time spent at home studying after didactic clinic hours with no additional compensation, dealing and managing stress and grief associated with patient encounters. You guys see a lot of really challenging and difficult things as you're on your clinical rotations. Negative leadership behavior, lack of social support from faculty, institutions, and your classmates and colleagues. So just to give you another visual here, to me, I feel like this is a little bit eye-opening. This graph represents the number of PubMed hits for the search term burnout. And look at that curve. This continues to just trend upward. You can see that burnout was searched a total of 2,145 times in 2019. And what is even more concerning, though not shocking, this was all pre-pandemic, which shows that burnout is becoming a more prevalent topic. So you guys did talk about burnout in stages quite a bit earlier today, so I won't dive too much into this again because you guys are probably experts at this time. So I'll leave this as a reference slide for you. I really did appreciate this picture and diagram though. So this is just another visual representation of burnout regarding the cycle and symptoms that can occur. Okay, so now as we move forward, just kind of checking on time to see where we're at. So we're going to talk about the implications of burnout and why this matters. So this really does matter because the effects of burnout are not always minor, and they really do have the ability to significantly impact and alter one's life. Physiological consequences, risks of motor vehicle accidents, risk of developing substance abuse dependence and disorders, and an increased risk of suicidality. So per an article in JAMA, the Journal of the American Medical Association, physician suicide rates are 70% higher than the general population. And for women physicians, it is 250 to 400% higher. And to put this into perspective for our profession, per NCCPA's 2021 statistical profile, there are 70% of PAs who identify as female. Burnout also has the ability to impact and damage our interpersonal relationships. Study time and other school-related tasks and obligations begin to impact our quality time, and relationships become pretty challenging. You come home at night, you are studying, you are trying to be productive. Quality time is just no longer quality time, and everything is kind of blurred together. So burnout is not only taking a toll on you, but it's also taking a toll on your support team and everyone around you. And burnout can also affect our children if we have children. Children with parents who exhibit depressed and anxious symptoms are also more likely to exhibit social isolation and anxiety. And then to make this more applicable to you all as well, if you guys are experiencing all of the symptoms of burnout, going through that, your mental health is being impacted, that is going to take a toll on you academically. Poor academic performance, academic integrity violations, you guys are just trying to survive, and all of that is going to be taking a hit. So moving on to a larger scale and thinking about how burnout can not only affect you as students, but affect you as future clinicians, let's talk about this. So when we're talking about patient safety and care, as we are burned out clinicians, if this continues to carry on throughout the years, this can lower quality care, increase patient care recovery time, decrease patient care outcomes, increase medical errors. You are at a higher risk of malpractice lawsuits and reduced patient satisfaction. And then this is also going to impact our healthcare system as a whole. Provider burnout may result in untimely job termination, leading to higher turnover rates. There may be increased costs. More funding is going to be spent in the recruitment process, trying to get new providers to take their places, and then decreased accessibility to care. So we can gather here that burnout is just not something to be taken lightly. So I think I was here for one of the sessions earlier and someone had said, what are some things that I should look for in a position to kind of protect myself and see what I'm getting into? And something to really ask is turnover rate. To protect yourself from burnout, asking these providers who you're interviewing, what does a turnover rate look like? Because if you have an office that you're interviewing at and they're having a new provider every couple of months or every 6 months, that may be a red flag if they're not able to retain staff. So what can be done about this? Well, first things first, administration, institutions, faculty, we all have a really large role to play, not only to ensure our students are successful within their journey of becoming confident and competent clinicians, but it is equally as important to really support you guys and make sure that you're emotionally and physically well. How many of you guys feel that you have support in place within your programs? And you don't have to raise your hand just because this is being recorded, but think to yourself right now, do you feel like you have structures and systems in place that make you feel well and promote wellness? Okay, I'm just prompting this question within your mind. Okay, we need to understand the risk factors associated with the onset of burnout in order to emphasize and promote wellness. We need to plan and implement burnout within curriculum. Do any of you guys have burnout within your curriculum? This might be a fair question to actually ask. I see a couple of heads nodding now. Okay. And kind of going off of that, we need to provide information to help you guys or help students better understand, recognize, and create opportunities to improve mental health and decrease burnout. If we're not providing education, if we're not providing resources, if we're not educating you guys on what burnout is, how are you guys going to know you're burned out? To me, I feel like we're not going to be able to set you up for success. And how are you guys going to know this is burnout versus this is just what PA school is? There's so much toxic behavior and thinking behind what PA school is. And if we think back to this toxic cycle of I had it bad, so you had it bad, and everyone's going to have it bad, this all exists within medicine. And if we're not educating you guys on what burnout is, how are you guys going to know the difference between I'm burned out and this is going down a really toxic path and road versus this is just not okay. And I actually need to seek out like help and take care of myself. So this is where we have some room and growth and changes to make within curriculum, within programs to help you guys remain more educated and be able to make these decisions for yourself. I really hope that as we continue to advance in medicine and as you guys graduate and enter this field, we can break that cycle and eliminate it of I suffered, you suffered. I was not a PA student too long ago. I graduated in 2019 and you guys are in that same spot. You guys will be right here where I am in just maybe a few months, years. I don't know how long. I don't know where you're at in your journey. A couple of you, I see PAS 1, 2. I know a few of you have recently graduated, which is amazing. But we all can do this together where we are working together to really create this change and help students, help promote this change and get rid of this negative cycle that is really detrimental for medicine. It doesn't have to be like this anymore. And we all are powerful. We have voices and we can make this change. You guys can do this. We can do this together, okay? You are going to put on your white coats. You're going to have PAC by your name, and you're going to be able to make change. And we can do this together. Okay, I'll get off that soapbox and move to the next slide. Okay, so that leaves us with the question of what can you do as students besides what I just said? What can you personally do to protect yourself and cope if you are experiencing burnout? Well, you can develop and implement coping strategies, which I'm sure you've heard a lot about today. We'll talk a little bit more about them in case we need to see more. When I was in PA school, I needed to hear things 6 or 7 times, maybe 8, and then again the next year for them to stick with me. So I will keep giving you tools and we'll see whatever works for you because everyone retains things differently. So I'll give you a bunch of stuff and you can see if you like it. And if you don't, you do not have to use it. Whatever works. Seeking out professional help. So taking medication or seeing a therapist, if that's something that you are willing to do and comfortable doing when you are in need. I love therapy. I preach therapy. I know that there have been other amazing speakers today that preach therapy as well. People assume that therapy is something you do for punishment when you are suffering. It's an awesome preventive tool to help you just cope. You do not have to be in a dark place to go to therapy. You can do therapy when you're well. It's a great tool. And then actively developing connections with colleagues, sharing and reflecting on aspects of being in PA school. Nobody understands what you guys are going through except for you guys, your colleagues, people who have graduated, your mentees, your mentors. We are all in this together. So nobody's going to understand it better than those who have done this journey and are doing this journey right by your side. Okay. And then spending quality time with friends and family. But let me preface those who fill up your cup. I have a lot of people in my life who I think would enjoy to spend time with me, particularly with my family, but sometimes they drain me. So we need to spend time with people who fill up our cup, who do not leave us feeling depleted. So just try to protect that energy of yours, okay? And then finding fulfillment in your journey as a PA through external engagements, but not spreading yourself too thin. So for example, this today is filling my cup up. I absolutely love getting to talk to students. This is something I'm super proud and happy to do. So finding things like this that make you proud to be a PA, things that you want to do as being a PA. Self-care practices, we'll talk more about that, cultivating personal interest and self-awareness, creating systems at home to help with lack of time and burnout. So if you can meal prep, working on time management, staying organized, we'll talk a little bit about that as well. Addressing triggers, figuring out what upsets you, what kind of sets you off so that you can avoid that or minimize it. Taking your time off when you are a practicing provider, because guess what? You are going to get no extra recognition by not taking your time off. Take that time off and run with it. Very far or just to a nice bedroom in your house. Whatever you can do, take your time off. And then having firm boundaries in place. You all know your own limits. Getting comfortable with saying no and trying not to spread ourselves too thin. It's really hard to say no. I personally have a history of being a doormat. It's really hard. It's just very hard. But start practicing putting boundaries in place, because when you're a PA, everyone's going to call you. Everyone's going to want help. Your programs are going to call you. Your job's going to call you. Just figure out what you want to do, what you're okay with doing, and then going from there. Okay. It's important to recognize that burnout is a system problem. This is not an individual issue. This is not a you problem. This is a system problem that needs to be addressed with systematic solutions. So building upon burnout prevention and coping strategies, seeking out mental health support and treatment is one of the largest ways to aid. However, this may be one of the methods that is most underutilized, but why is that? And the first one is bolded and capitalized and in a different color, stigma. Stigma is huge. There's also fear of judgment, discrimination. We talked about this earlier, misconception of appearing weak. We're programmed to cope and solve problems alone. We're in that survival mentality. We are afraid of this impacting our academic record. We don't want our faculty to hear about it because we are afraid that they might treat us differently. Those are all very fair assumptions. Financial cost. PA school is very expensive, and oftentimes therapy is not covered on our insurance plans. Geographical and accessibility barriers, lack of social support, and personal limitations. And based on Medscape's National Physician Burnout and Depression Report, there are a few that really hit close to home and took me back for a second. So they did not want to risk disclosure to a medical board. They were concerned about it being on their insurance record, and they were concerned that the medical profession was going to shun them. So this was really unfortunate to read. It's unfortunate to know that this is our reality, you guys, that we can be deemed incompetent or unworthy to practice medicine by wanting to seek out and get help for our mental health, or just by wanting to seek out treatment. So this is why these lectures are so important. This is why these conversations matter, and why we really have to just keep showing up, supporting each other, and being brave when it's scary. Many studies find considerable overlap between burnout and depression, but controversy exists about whether they are two distinct entities. So the question is, when should a person consider seeking out help and treatment? When is it too far? What are some warning signs to watch out for? So individuals maybe aren't physically taking care of themselves anymore. They are no longer showing up for important obligations, responsibilities. They're having passive or active suicidal thoughts. They're abusing substances or engaging in risky behavior as a means to cope. They're not allowing oneself to be with their thoughts. So maybe they're using a distraction to escape. Maybe they just feel like they can't be alone, constantly scrolling through social media as a means to cope, things like that. Or maybe someone would just simply like to improve the way they feel and would like help and therefore would like to go seek out a therapist. When you are placed in a stressful and demanding environment, you learn to adapt. I like to tell people that those of us in medicine make the best chameleons. And it's not really something that we should be proud of. We have unbearable stress, pressure, guilt. This is our new normal. We're adapting, we're morphing, we're changing, and then we're getting more, and then we're adapting, we're morphing, we're changing. And then all of a sudden, we find ourselves maybe in a place that we never intended to be in because we're so good at just being flexible and blending in. So it's really important to just seek out that support, that mental health treatment, if we're willing to, and just be aware of what's going on before we end up in a place that we did not intend to be in. So this is a document that I created. I believe it's on your toolkit per Liz. This is a list of national resources for you guys. It has all kinds of resources for you, warm lines, crisis lines, text lines, and I hope that you will screenshot it, put it in your favorites in case you are ever in need or if you know someone who is in need. So there you go. And as we transition after this, we are going to talk about how to actually cope through some of these things. So these slides are pretty dense on purpose. I hope that they serve as a resource for you guys. So please feel free to screenshot them for use of later time. So if you're feeling overwhelmed, where can you start with this? So these are some meditation apps. I use some of them were recommended to me. So I put this list together for you guys. I just want to provide you guys with something to take away for this from this presentation. So first things first, meditation apps. How many of you guys have used meditation apps before? Some of you. I personally am not a meditator. I can't really sit still, but I know many of you can. So if you're a meditator, these are for you. We'll go on to coping skills. Have you guys heard of coping skills before? Yeah. Okay, so coping skills are skills to help us tolerate, minimize, and deal with stressful situations. We have emotional and problem-based coping skills. So many of you probably already use coping skills and maybe you're not aware that it is a coping skill. They can be highly beneficial for you. So here are some other examples, like exercise, writing in a journal, drawing, painting, creating, cooking a meal. So just some other tools for you guys to utilize. You guys okay if I move on to the next slide? Okay. And then we have grounding exercises. So these are for those tough times. You know, it's really easy to be consumed by stress and feel like you're drowning, especially in PA school. I really feel for you guys, I really do. Stress is compounding. It can really trigger unwanted emotions and provoke things that sometimes we don't want to feel. Some things we're trying to forget that we have felt before. And grounding exercises are a way to really bring you back to that present moment. They're really good for anxiety, for stress, depression, dissociation. They can be really quick, like taking deep belly breaths, or longer, more formal exercises. I really like the 5-4-3-2-1 method. That's this one right over here. That's why it's bigger, because I like it a lot. So it's 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And then you can repeat that as needed as you're just kind of sitting wherever you are, just really trying to focus in on things around you. And then here are some other bulleted listed grounding exercises for you. I also really like guided imagery. So right now I'm currently living in Idaho. This is an adjustment for me. I'm from Utah. It's very similar to Utah, but I am for sure an East Coast girl. I belong over there. So my guided imagery is thinking of New England fall or in New York City. I lived in New York prior to moving to Idaho. So I'll close my eyes and think of a long walk past the Empire State Building when I'm just like up to here in stress. So guided imagery, I think, is very powerful, and it's kind of a nice way to decompress and take you to your happy place. So you can dive into your happy place moments and go from there. So some mindfulness exercises. Any mindfulness fans out there? Maybe. So we can ultimately use these exercises to really pay attention to our thoughts and sensations and focus in on that present moment. So there's a lot of evidence behind mindfulness and how it can be beneficial for us. So it can lower our blood pressure, really helping us with cardiovascular benefits, decrease stress levels, help with sleeping patterns, changes in sex drive, muscle tension, pain. So there's a lot of really good positive health benefits by implementing mindfulness exercises into our life. So this is more of an FYI slide for you to take a picture of in case you are in need. Let me know when you're ready for me to go on to the next one. Yeah, okay. I feel like this one deserves its own slide. I love square breathing. I like it because it's quick, it's efficient, and you can do it anywhere. I do this if I'm like in my office, I will go hide around a corner. I've done it in supply closets. I do it in the shower. I do it when I'm laying in bed. I just envision a box being built. You're going to inhale for a count of 4, rest and hold for a count of 4, exhale for a count of 4, rest and hold for a count of 4, and repeat. And as you're closing your eyes, you can just really envision a box being built. This was taught to me a couple of years ago, and it really stuck. I can't do mindfulness. I can't do meditation, but I can do square breathing for my mind that constantly feels like a hamster wheel. So this might work for you guys who are not really fans of mindfulness. I really love it. So this one might be for you. I'm kind of zooming through these slides so we can make sure that we finish and have a little bit of time for questions. Okay, so self-care, I just want you to kind of briefly think for a few moments of what you define as self-care and what self-care means for you. I know that you guys have heard about self-care like all day today, because self-care is very, very important when you are burning out or feeling like you are burning out, or when your mental health is really taking a toll. So now that you kind of have this idea of what self-care is within your mind, I want you to kind of think of some examples of what you enjoy doing for basically taking care of yourself, wellness needs, things like that. What are some things that make you feel well as an individual? So do you sleep 8 hours a night? Do you hydrate? Do you snack throughout the day? Do you say no to people? Do you have firm boundaries? Things like that. And think about it. Do those lists compare? What makes you feel well and self-care? Because when I did this, they did not. They were not the same thing at all. And it was very eye-opening to me, because I think oftentimes we think that we're doing self-care. We're like, I'm going to go home and I'm going to put a face mask on, or I'm going to go buy coffee, or I'm going to go shopping, and we're treating ourselves. And there's nothing wrong with treating ourselves, but it's like, are we actually taking time to take care of ourselves, addressing our needs, really nurturing ourselves, and doing what our body needs to thrive and feel well? Because I think in today's society, we really do ignore our basic needs, and people make us feel guilty and bad for doing that. And that's really messed up. It's so bad. They're just like, no, you have another meeting to go to, or you need to be prepping for your work tomorrow. You guys have another exam tomorrow. And after that, you've got another exam and an assessment, and then you have to turn in your clinical log. It's just thing after thing. And then you're like, but what about my sleep? Or I forgot to eat today. We should not be proud of not peeing for 13 hours. No, this is not okay. This is not okay. So really just focus on those 2 lists and see how you can mesh them together so that you are implementing self-care with self-needs. So tips on staying motivated, having more control in your life. I think when you're in PA school, you feel like everything has been taken from you. I felt like everything was taken from me. It was like, I am living on my Google Calendar. This is my diary, and it is what it is. Unfortunately, this is my lifeline. I'm on an island, and this is what it is. There's no rafts to come get me. This is it. So things that you can do, trying to have elements in your life that feel like a routine. You know, you're feeling low, you're feeling burned out, you are nearing the end of the year, you're at your point in your clinical journey, And I feel like there's such a loss of control within PA school, and that's really hard. You guys are adults, but maybe you feel like I felt like I was being treated like a child, not by my faculty, but because I did not have a control in my life. And that was really hard for me. But then I had to focus on the big picture. And I was like, this is what I'm doing for myself. And also remembering to give yourself grace and knowing other areas are going to, I don't want to say lack, but they're not going to be as strong as they were before you started PA school. So I had a student ask me the other day, did you gain weight or eat differently when you were in PA school? And I was like, yeah, I gained 30 pounds and I just couldn't take care of myself the same way. Was it the most healthy? Probably not, but I could not do it. I was doing the best I could with the resources I was given. And I think you guys all really need to remember that that is okay. Some areas in your life are not going to be as balanced as they were before, but that's because you have a very large task in front of you. But once this task has kind of, spread out and is a little bit different after you graduate, other areas in your life are going to kind of normalize again. And it's important to remember that. So creating routine where you can, getting up and walking down the hall 3 times if you're wanting more movement, doing things like that, or setting a reminder on your phone to drink water, just little basic things. So you could say, yes, I have control in my life. And this is something I'm doing for me because I want to, or I'm going to stop studying at 10 p.m. or 11 p.m., whatever it is you choose. And after that, I'm not doing more. You guys deserve to have some control in your life. So setting those boundaries up for you, whatever it is. So incorporating those SMART goals and just knowing that that's okay. So kind of mixing that with this too. Your physical activity is going to look different, being realistic to yourself. You may not be able to go to the gym or work out in your house every day for an hour every single day. That's okay. Figure out what works for you. I'm going to walk to the mailbox and get my mail today, or I'm going to walk down the road, or I'm going to go play with my pet, or I'm going to walk around with my child. Just incorporate it into your life in a way that fits with you and know that that's okay. I think we want to be who we used to be before we were PA school, but that's not fair to you guys. It's not fair. You guys are different people than you were 6 months ago, than you were a year ago, than you were last month. And you got to remember that. And that's okay. Do things to make you feel in control. Remember to eat, remember to drink, even though you probably can't if you're on your surgery rotations, but do the best you can with where you're at. I'm just rushing through these slides so I can make sure I finish on time. And then just remember to focus on your mental health and your physical health. They're highly mixed together. We know that they impact each other. Making sure we're sleeping enough because it's going to impact our mood, setting those boundaries with people. We want to focus on people that make us feel well and are not draining us. Seeking out people who you really do feel safe with. Connecting with your faculty and advisors if you feel safe with them. If there's somebody else in your program that you connect with who's a faculty member, seek out them. Maybe you don't vibe well with your advisor who's been assigned to you, and that's okay. Communicate with them respectfully for what you need to, but find someone that you do feel safe with, because that's going to be really important for your mental health. Okay. This stuff you guys all know about. And then mental health in terms of an onion. I think this is a ridiculous slide, but it's true. Onions are painful. I was telling Liz this the other day. Onions are painful. I hate onions. I actually love to eat them, but I hate them. I cry. They hurt. They're just terrible. But there are ways to make it less painful. And it's the same with mental health. Mental health is like a brutal onion. We can utilize therapy. You can utilize your support team, medications, things like that. And it's just like an onion. You can soak them. Liz taught me you can soak them in water. You can put on running water. You can put on goggles to make it better. So there are things to help you guys with your mental health. You don't have to put a burning onion on your eyes every day. There are things to lessen that pain. And then false expectations. This is my favorite slide. I know it looks a little ridiculous. And I put this picture of me on here because this was me as a student. I looked happy. I looked like I was having a great time. And while I was vulnerable and practiced what I preach, I also struggled in PA school, and I made that known. I was on Lexapro. I struggled with health problems. It was rough for me. So I want you to not compare yourself to people on social media. Social media is literally a disaster at times. It is hard to look at people who are balancing their lives wonderfully and look so happy and are so fabulous in their white coat and their scrubs. But I want you to remember that everything is an illusion. Everything is an illusion after that camera lens. Your life is only as awesome as you pretend it is on Instagram or Facebook. Remember that diamond in that coal picture right there. What you guys see is a diamond. On the other side, people probably are morphing themselves into that diamond from coal. They're under a lot of pressure and strain, but you guys don't see that part. So you can't expect yourself to be this beautiful, sparkling diamond all the time. Okay? Just remember that. You are very strong through vulnerability. You guys are more than a statistic. Just keep remembering that you have so many people supporting you, cheering you on, that have your back. I will say the one thing that I love the most about this profession is the support that it comes with. This PA community is strong. It has your back. People will come out from corners you had no idea they existed in, and they will show up for you. I will show up for every single one of you. If you ever need me, you reach out to me and I will be in your corner to help you and support you. And then, well, I guess I just kicked myself out of this. I was going to say that mental health matters, and I guess I will go to this real quick. I don't know what happened. I'm sorry, guys. We are gonna go like that. Mental health matters. Focus on what you control. Don't discredit your feelings. Everybody's going to go through something differently. Acknowledge your feelings, your thoughts, and most importantly, this is in the way. It wouldn't be me if there wasn't something wrong with it and going weird, but we embrace our odd moments. Be kind to yourself and know that you guys deserve to be here and that we're super proud of you. So I am done rambling because I went over by 3 minutes and I apologize, but I just want to thank you for the time being here and sharing my story. So thank you all.
Thank you so much, Ariana. You're so amazing. Trying to see. Oh, there's a question in the chat. Chelsea says, I'm currently in my surgery rotation and I feel like the pimping culture when providers drill students on medical knowledge is incredibly toxic and definitely contributing to my burnout and negative mental health as a PA student. I want to discuss this in my evaluation of the precepting organization, but pimping seems so ingrained and normalized in medical healthcare culture that my program had to prepare us for possibly getting pimped. I'm wondering what your thoughts are about this culture and if it's worth bringing up on my evaluation.
I think anything that you question, should I bring this up, should always be brought up. Always. I want to remind every student that your concerns are valid. And if you're questioning, can I or should I bring this up? You absolutely do it. If you're in an environment in a program that you don't feel safe in, can I bring it up? You should still bring it up. You should still bring it up. I do think that we are in a place that is getting better with medicine as far as the I suffered, you suffered cycle, and pimping kind of falls in that. I was in burn surgery and was like my second shift, and I just like this brand new little PA with trauma burn surgery, and they pimped me in front of, I kid you not, there were 40 people on burn trauma rounds, and I was just like, this is horrible. I feel so inadequate. I feel horrible. So I feel for you. I'm so sorry you're going through this right now. But I want you to know that like, we are here to support you. You are not inadequate. You are not stupid. Sometimes people are doing it to make you feel small. Sometimes preceptors are doing it because oftentimes we learn from not remembering and we learn better from our mistakes. It's not the most effective method. Some people learn great from it, but I think each of us learns so uniquely and differently. And it's important for preceptors to get to know how we learn. But unfortunately, not everyone teaches like that. So my advice to you would be to, one, communicate with the preceptor if you feel safe doing so. If this is a preceptor that is approachable and you could express how you're feeling and let them know how you learn best. If it's not a safe environment, I would talk to your program and I would absolutely bring it up, because here you are voicing your concerns to promote more change for the students coming in after you.
All right, awesome. Now I'm just gonna have one more question. Sammy asked, as I'm starting to apply for jobs, what is a good way to gauge the mental health burnout environment of the organization? Is there a question you would recommend asking in interviews?
Yes. So I would recommend, one, I would recommend asking if you can come in and shadow for a day. I would recommend talking to the actual PAs who are on the service. And I would ask if you could, it's not always possible, but see if you could pull them aside privately and talk to them and ask them how their work-life balance is. I feel like oftentimes you may speak with like administrators or people in environments, and they're going to tell you exactly what you want to hear. But talking to people who are actually there, if they are a good person, they will drop hints to let you know. But asking about the turnover rate, I feel like that's pretty transparent. But yes, try to shadow, come in, talk to the PAs if you can privately, ask them about their work-life balance, ask them how long they've been there, ask them if there's anything that they really enjoy about their job, ask them maybe what the most challenging parts of their job are and how they've handled that. And if they had any advice for you if you were to take this job, what it would be. Maybe some things like that would be a great start for it. If you guys have any other questions, feel free to reach out to me on my Instagram or shoot me an email. And once again, thank you so much for your time. I know it's late for you guys on the East Coast, so I'm so sorry for going over.
Thank you so much for your time. This was amazing and wonderful. And now I will throw it off to Sonia to do our closing address.